You're listening to the Chemical Sensitivity Podcast. I'm Aaron Goodman. In Japan, some research has shown that many people with multiple chemical sensitivity, MCS, associate the onset of their illness with exposure to fragrance in personal care products, laundry products, including fabric softeners, and in public spaces. Some are forced to leave their jobs, others can no longer attend school, and many struggle to access medical care or even safe housing. Yet despite the profound disruption to people's lives, MCS remains poorly understood and often invisible. Is Japan facing a multiple chemical sensitivity crisis? Today's guests bring first-hand insight into this urgent question. Yasuko Kato is a journalist and director of the Life Environmental Network, a self-help organization supporting people with MCS and electromagnetic hypersensitivity. For decades, Yasuko has documented environmental health risks and advocated for those affected. I'm also joined by Sekyung Jung, a research fellow and PhD candidate in sociology at the University of Tokyo. Sekyung's research focuses on MCS and examines how people with the illness navigate stigma, barriers to care, and the struggle for recognition. Together, Yasuko and Sekyung help us understand the scale of MCS in Japan, the substances driving it, and what this may reveal about a growing public health challenge. Some exciting news: the podcast has a new webpage. It's listen.chemicalsensitivitypodcast.org. It's easy to share with anyone in your life, including doctors, employers, family members, and others who may want to better understand chemical intolerance and MCS. Please find and subscribe to the podcast wherever you get your podcasts. And to learn more, you can follow the podcast on YouTube, Facebook, X, Instagram, Blue Sky, TikTok, and LinkedIn. And you can reach me at aaron@chemicalsensitivitypodcast.org. Thanks for listening. Well, Yasuko and Sekyun, thanks so much for joining me.
Thank you for having me.
It's my pleasure.
Would you like to start by perhaps briefly introducing yourselves? Yasuko, would you like to start?
Okay, I am a journalist and director of a self-help group for people with multiple chemical sensitivity and electromagnetic hypersensitivity, Life Environmental Network. As a journalist, I have been writing about a nature protection issue. After I got sick, my main subjects are environmental factors and health problems.
So you've been a journalist for quite a long time.
Yes, about 30 years.
Do you want to talk about your lived experience with MCS briefly?
Yes, I had got MCS in 1999 and had complicated electromagnetic hypersensitivity in 2002. I have been suffering severe I have been suffering severe endometriosis long time. After I had took the newly prescribed drug, my MCS had begun. When I exposed to tobacco, exhaust gas, and detergent, I experienced palpitation, difficulty breathing, and headache. My symptoms became more severe as time passed. I have been almost sick in bed for some months. I avoided chemicals and took vitamins and minerals. Then my symptoms got better little by little in 3 years. Then I got electromagnetic hypersensitivity. Now I am linked to not only chemicals but also electromagnetic radiation and low frequency noises.
Very challenging. And Sekyung,
Hi. So since 2021, I've been interviewing people in Japan who lives with MCS. And I forgot to introduce myself, my name. My name is Taekyung Jang from Korea and studying in University of Tokyo, Japan. And my major is sociology. So I am interviewing people of MCS in Japan, and my research focuses on how their experiences are often questioned or not fully recognized, and how patients work to make their condition visible and understood. Based on this work, I completed my master's thesis titled The Delegitimation and Resistance of Experience in MCS. And also, I have submitted a journal article that explores the invisibility of MCS and how people navigate the space between being seen as a patient and being treated as a victim. So far, I interviewed about 29 patients, and I'm currently analyzing the data as I prepare my doctoral dissertation. And I've also presented at academic conferences about the operation and closure of a patient care facility in Japan, as well as ongoing anti-fragrance activism in Japan civil society.
Sekyung, it's very impressive and very interesting. And I want to know, why did you choose to focus your research on MCS when you could have chosen any illness or any issue? What drew you to MCS?
Yes, thank you for your question. My interest is in this topic is also deeply personal. During menopause, my mother began experiencing a range of symptoms like nausea and headaches, something like that. And at one point, she suddenly started reacting to things like car exhaust and food additives and cosmetics. As a result, my mom had difficulty eating and lost more than 10 kilograms. So I've also had my own experiences that made me more aware of these issues. Over the past few years, I began to develop these symptoms. For example, I have developed migraines triggered by cigarette smoke from people passing by on the street, and as well as by perfumes and fabric softeners used by classmates. And once I even felt nauseous and vomited after being exposed to strong perfume scents on the subway. And these kind of personal experiences led me to ask a simple but important questions. What happens when an illness is real for patients but remains invisible or misunderstood by society?
Misunderstood. And you mentioned the difficult situation you face and your mother faced. Do you consider that this is MCS for you?
Yeah, I think I am not diagnosed yet, but I cannot deny I am free from MCS.
Mhm.
So, it happens to women a lot. And I think there might be a possibility for me to get MCS like my mom did.
How much of a problem is MCS? Do you have a sense of how many people in Japan live with MCS, and is it a growing problem?
Yes. In Japan, Professor Ken Ichijima estimated MCS among Japanese adults to be 7.5% in 2015. And Associate Professor Masato Nagayoshi of Niigata College of Nursing recently conducted a questionnaire survey of 10,000 children and estimated approximately 10% of children experienced health problems due to fragrance. The rate of poor health increased with each grade level. Main symptom was headache, stomachache, and muscle pain. His research was widely published in Japanese media last year. In, in Japan, MCS was recognized as disease, but uh, MCS specialist is very few. I conducted a questionnaire survey in 2012. I, I found 10 specialists in all of Japan. So many patients has symptoms and they cannot go to hospitals and they cannot get medical treatment. So many people are suffering in their residence.
How do most clinicians, doctors, healthcare professionals respond?
Specialist MCS specialist is very limited in Japan. For example, even when I get sick, it's difficult for me to receive medical treatment. Fortunately, I have a dentist who understands MCS and EHS, so I can get dental care. However, I react badly to the medication used in eye exam, so I can't even undergo basic tests. When I went to surgery after an injury, the medication caused me severe palpitations. The nurse knew about MCS, confirmed my palpitations, and let me rest in bed, but the doctor dismissed it, saying there is no way that medication should cause such a reaction. Also, MCS recognized as medical condition in Japan, there are very few specialists. Previously, some national hospitals had chemical-free examination rooms for MCS patients, but these rooms were removed due to high maintenance costs.
Do you see it as an urgent public health situation?
Yes, I think it is a urgent situation in Japan because there is no official searching and studying is going on about the numbers of people who are suffering from MCS. But I can see many people who are suffering from fabric softeners and fragrances, and especially fabric softener is a big problem in Japan. And when I get on the train to commute, I cannot breathe. I cannot breathe from the fabric softeners. So, and I feel sometimes headaches. And also, I heard there are many children who feels headaches or some uncomfortable inside their classroom because all children, like 30 or 40 children, they use everyone used fabric softeners, so they gather together in the classroom and they close windows and they spend their all times like over 7 to 8 hours in the classroom. So the air quality will go down, of course, because of fabric softeners. But even though the children says it is really uncomfortable and feels bad from the smell of fabric softeners, but no one is listening for them. So I think it is a big problem in Japan.
Mhm. There are so many questions I have about fabric softeners and their impact on health. When we go to the grocery store in North America, there's fabric softener for sale, and it has a very powerful smell. but I think there's something unique about the products that are sold and advertised in Japan.
In Japan, it's very humid, so we sweat a lot, and there's a cultural background also the problem, I think, because we think be clean is very, very important to meet with others in the weather of very humid. So even it is very easy to get sweat in the winter because of the humidity. So people always care about their smell from them. So especially the people who working at service area, like, delivering or the nurses in the hospitals or teachers or the people who are working at groceries, they don't want people feel the smell from their body. So they put a lot of fabric softener. So people think it is a good manner for others. So, and they put softeners like almost every day when they wash clothes. So, and as you know, actually the smell from the softener is getting stronger because the companies make something special techniques to, stay the scent longer. In the end, the scent getting longer by the companies and people use them every day makes a big kind of a result. It smells really, really strong than any other countries, I feel.
That's what I understand too, that entire neighborhoods are often filled with the smell of fabric softener. And is it the case, Yasuko, that people sometimes, even when they close their windows in their own homes, they cannot stop the fragrance from coming into their own homes?
Yes, yes. Many people are suffering neighborhoods used fragrance. Um, MCS people cannot open the window because fragrance came into their house.
Can you help me understand a little bit more about the nature of fabric softener in Japan, how they're used? In North America, we often use electronic dryers to dry the clothes. And people put a fabric softener sheet, a piece of material that's very scented and toxic. And then it heats up and it's emitted through the dryer vent. And that's what fills the air outside of the home. And that smell can cover a great distance. But in Japan, do people use dryers or is it in mixed with the water when the clothes are washed with water? How does it work, Sekyun? Can you help me understand?
People just hang their clothes after when they wash it outside. But as you know, the houses, neighbors are very close together each other and very condensed. So I can just feel the smell from the next doors easily. And there's no wall between my house to neighbor's house. Uh, there's only slight plastic walls exist between me and neighbors because in the situation of emergency, we have to break the walls and we can run away to be safe place. So that's how Japanese houses are made of. So it's really easy to come in all the smells from other neighbors when I open the window. And even though I close the window, it is, there is space, so air's coming in. So
Uh-huh.
there's no way to run away from softeners
Mm.
away when I stay in the city like Tokyo or Osaka, something like that.
Yeah, and you mentioned the cities where I understand fabric softeners are a big problem, but I also understand that the countryside and smaller communities and villages close to nature are also impacted by this. Is that right, Yasuko?
Yes, it's right. Uh, in countryside, there are many problems without fragrances. For example, smoke of
Pesticides?
pesticides, yes,
Yeah.
pesticides, and fabric softener in Japan. Fabric softener has as a problem. For example, United States has a smart label system. Consumers can research allergens or uh, hazards of chemicals, but we cannot have this system.
Mm,
We cannot access information, access to hazardous information.
mm,
And EU restricted 82 chemicals as allergen, and some countries will, will be follow them, but
mm,
Japan never adopt precautionary principle.
mm, mm,
For example, reproductive toxicity Lilia was banned in EU and some countries followed it, but P&G Japan continued to use Lilia some of their products.
What is the name of that specific product, please?
Lilia case number 8045
Mm,
5446.
And this is a chemical in fragrance.
Yes, fragrance.
Is that what's in fabric softener?
Yes.
Uh, so, do we know what the most harmful chemicals are in fabric softener? Do we have a sense of what these are?
ああ、そうですね。what, what, あ、in Japan, we can check the manufacturer's homepage website and it fragrance's name are informed, and we can check the uh, government site the risk of uh, each chemicals.
Mm,
Japanese government had a 職場の安全、safety of workplace website. We
mhm,
can check the name of chemicals and hazards.
mm. We can check on the government website, but it's not listed on the product itself, correct?
Yes, uh, mm, yes, we can access each chemicals, but what product is danger we cannot understand. All manufacturers open the information of fragrance name. Uh, they disclosed which chemicals used as fragrance, but that's only. If Americans' smart label systems, uh, we can check the each chemical's risk on manufacturer's site.
Mm.
Manufacturer uh, disclosed every information on chemicals, but we can access to government's website to find out the risk of fragrance.
So there's a lot of work that needs to happen to find out, and
Yes,
it's not easy for the average consumer to do that kind of work, would you say?
Yes, that's right.
Do you think more and more people, Sekyung, are coming to an understanding that fabric softener is is not a great thing?
Unfortunately, no, I don't think so. Even though it is kind of a successful civil movement in Japan, they are raising Kogai movement in Japan, so they are raising alert about using fabric softeners to the people in Japan. But almost all people think it is clean to use fabric softener than not using it. So
Mhm.
people don't want to stop using it. So I feel really sad about this.
I think it is very sad because Japan has such a wonderful natural smell.
And actually, many patients who interviewed with me telling that even though they are living in rural area, they can smell the fabric softeners from the water when they cook or
Mm.
when they use water um from the facility they have inside their houses. Tap water. They can feel the smells from the tap water too, even though they are,
Mm.
you know, really far away from the cities.
And have there been studies that have connected the chemicals in fabric softener to MCS?
Okay. Professor Ko Sakabe of Chiba University states that 70% of MCS patients report that their MCS began with fragrance products such as fabric softener and detergent. And
Mhm.
previously, sick building syndrome was uh, focused on in Japan.
Mhm.
Now, uh, main trigger of MCS have shifted from building materials to fragrances.
Mm. I think it would be interesting to talk a little bit about the impact of these products on people in Japan. And Sekyung, I believe in one of your studies, you showed or you learned that a very high percentage of working people had to leave their jobs because of their experiences with MCS.
Yes, actually, I heard many episodes about how it is difficult to work. For example, my patients face serious challenges in the workplace. Some have raised concern about fragrance products commonly found in offices, such as air fresheners in restroom and dishwashing detergent in kitchens or hand sanitizers, but their requests for the change were often ignored. And also in some cases, patients asked colleagues to reduce the use of perfumes or fragrance fabric softeners, but they were told by supervisors that it bothers others a lot. So they had to quit in the end their job. And also, there are many examples from the education sector. One patient who worked as a teacher or suffer from the fabric softeners from the children. So the teacher bought the fragrance-free softeners and she bought them and gave it to the patients. And she write handwriters a lot. And she gave it to the people related to the school. But after all, her supervisor also said her, it is okay that to tell that you are sick, but please don't tell the cause of your sickness is from the detergent because there are other um, uh, parents who are working for the detergent companies. So we are teachers, so you are not allowed to tell about your causes of sickness.
Mm.
So that's how it's going on in Japan right now.
Yeah, it sounds like there's a distance in the workplace from managers or employers for change because it
Yes.
sounds like they don't want to risk offending either people who use fragrance or people who happen to work for the companies. Is that right?
Yes, right. In Japan society, it is not favorable to make problems. So just be they want to be in peace without making any problems, suggesting any issues about their health problems.
And
So,
in the meantime, it must be a daily struggle for millions of people. Children, you mentioned 10% of children, millions of adults trying to just go to work and go about their day.
they struggle a lot and they want to show that MCS is not the lie or the problem of their mind. So there are some patients who take pictures of her skin every day to show that, to prove that it is true that I have something going on in my body, which is called MCS. So they struggles a lot to prove that.
It sounds like there is a lot of disbelief and stigma and psychologizing. Are people often told it's a psychological disorder?
Yes. Uh, and also there are patients who are forced to divorce because her family didn't believe the existence of the disease of MCS. And also there is a father who is not ill, but his children got MCS, but he did not want to admit that his children got MCS, so he did not allow the children to use masks when they go out. It's kind of very sad to hear that. And also there is a family members who pushed the patient to recover through her own willpower because they think it is the mind problem.
And Yasuko, in your work as a journalist and advocate, you've been working to create greater awareness about MCS. I'm interested to know more about the grassroots advocacy that you and others are doing.
I organized a self-help group and have continued to provide patients with information of various environmental factors. I have also lobbied members of the Diet and the Japan Federation of Bar Association to address their sensitivities. What is make ごめんなさい。And the Japan Federation of Bar Association submitted a statement on opinion electromagnetic fields to the government. Now they are working on issue of fragrances. The opinion paper has, does not have direct legal binding force. It can propose legal reforms and politics and stimulate social debates.
So, what would greater government action look like? What do they need to do?
I want to introduce fragrance-free policy like Canada and America, United States. And fundamentally, in Japan has lack of knowledge about reasonable accommodation. This is a new concept for Japan, so many people does not know what is reasonable accommodation for MCS patients.
Mm.
If people with MCS request a reasonable accommodation, many of them are rejected by misunderstanding.
Mm. Yeah. So at the moment, it sounds like there are no fragrance-free policies in Japan. Is that correct?
Yes, that's right.
Mm.
We need it.
And
Serious.
you seriously need it. And not even in hospitals or medical offices.
Some nurses have to resign their job due to coworkers' fragrances. They
Mm.
ask to non-fragrance environment in their hospitals, but
Mhm.
they rejected.
And you mentioned before, I believe, that even nurses are often some of the people who often wear fragrance and use fabric softener.
Yes, that's right.
Mm.
And one mother said, when I asked for unlicensed product at kindergarten, they accused me of violating human rights and threatening to sue me.
Mhm.
So I was forced to leave.
Mhm.
And some children have to study at schoolyard. They cannot enter in their classroom
Mm.
by fragrance of other classmates.
Yeah, I want to ask you more about that. Can you talk more about how school children and students are affected by fabric softener?
Yes. For example, two brothers have to study another classroom with no classmate. They are studying with only two, and they are separated, perfectly separated with other children. They can allowed to enter in their class from window because main entrance is very high contaminated by fragrances with
Mhm.
other children. They cannot use main entrance.
You cited 10% of children across Japan are having day-to-day challenges just going to school because of fabric softener and fragrance contamination.
Yes, that's right. They exposed to fragrance in school and public transportation. When they came to their home, they back to their home, they immediately wash their body to reject fragrance,
Mhm.
but they cannot read textbook in their home. Paper was exposed to fragrance. They are very contaminated,
Mm.
and children cannot learn enough.
It's very heartbreaking. It's almost impossible to imagine the scale of the problem, but it is such a critical situation. More and more fragrance production, use, purchasing, marketing, and very little government action.
Yes, in Japan, when sick building syndrome was uh, focused, the government restricted the chemicals from building materials. but there is no restriction on fragrances.
Why do you think that is, Yasuko?
Yes, we need new restriction for fragrances, and there is a program. The consumer products do not display GHS pictograms that indicating the risks of chemicals used in the product. But in Japan, consumer products never show GHS pictograms. Same detergent, there is same detergent for workplace and for consumers. For workplace products has GHS pictograms, but it's not showed on consumer products.
Mm.
They are same chemicals. They use same chemicals, but consumer cannot access to correct information.
Yes, in your support group that you run, are people finding it of benefit?
I am collecting information from people with MCS and EHS, and we share the information via newsletter or homepage. And we are collecting information and make more better environment for us.
May I ask, if it's too personal, just let me know, but how has MCS impacted you as someone who's actively studying, and you mentioned you're going to complete your PhD? I imagine must be a day-to-day challenge as well.
Actually, I have many challenges every day. For example, there are many people just smoking outside on by walking. So it is really highly chances for me to get exposed by second smoking. So I am very concerned about it every day. And when I go to school, there are many students who's wearing fragrances, including a shampoo with strong smell, and they use all of them at the same time, so it smells very strong. And also in the toilet, public toilet in Japan, there is a hand sanitizer which smells a lot. So I have to stop breathing when I go into the toilet sometimes. And especially after the corona happened, I think there are more like people want to make it clean. So every single sanitizers have alcohols, including many chemicals, of course. And also they want to make people feel good. I don't know, but they mix fragrances together with sanitizers. So there are many products like that. The products like that are used in the restaurant. So it makes me to feel uncomfortable to enjoy my meal in the restaurant in Japan. So I have to bring always masks, or I have to finish my dishes as fast as I. There are many patients who suffering a lot than me, but also for me, it is not easy to go outside without worrying about getting exposures from fragrances in Japan.
Outside and in indoor environments. A lot of people who listen and watch this podcast are outside of Japan. Is there anything you'd like to communicate to folks about the situation there that we may not be familiar?
Yes, of course. I have two things to want to share with others outside of Japan. First is that my home country, Korea, is also suffering from the using fragrances, and but it is kind of a little bit different. Japan's big problem is fabric softener, but in Korea, fragrances and diffusers, indoor diffusers are making a big problems between people, but lower recognition about the problem. There's a differences about the problem, but people want to exchange their information to make the recognition level higher.
Mm.
So I think these two countries can cooperate each other. And in Japan, the government, like Consumer Affairs Agency and the Ministry of Education and the Ministry of Health and the Ministry of Economy joined together and they made awareness poster in 2021 in Japan. But the problem was like they were saying like there might be a person who are suffering from fragrances. So it makes no sense to the patients who are suffering from fragrances. So patients got so angry about the poster that was made by the government in Japan.
Mm.
So
Mm.
the Japan government changed the word. There is a patient who are suffering from the
Mm.
fragrances. It means that still there is a doubt and between the people working in the governments about
Mm.
the MCS, and they think there is no scientific evidences for supporting MCS. But I think the body of the patients, which is going through the pain every day, like every moment, their body is the evidence
Mm.
for the MCS itself. So I think the government should be respectful about the experiences of the patient. Yeah,
Mm.
that's all.
Thank you. And
Thank you.
Yasuko, is there anything you'd like to share um, in closing about the situation in Japan?
Japanese government funds research on health hazards from MCS and fragrance and has received research reports pointing out harmful effects of fragrances. However, when deciding policy, it has delayed action, citing the lack of a clear mechanism for how fragrance causes health problems. But it is time to introduce correct policy. For example, we need free fragrance-free policy and to save our children. Many children cannot go to school and playing with their friends in schoolyards. We have to stop this. In many countries, people with MCS face the same challenges. I would like to cooperate with self-help groups overseas, exchanging information and create an environment with fewer environmental factors such as chemicals and electromagnetic fields.
You've been listening to the Chemical Sensitivity Podcast. I'm the host and podcast creator, Aaron Goodman. The Chemical Sensitivity Podcast is by and for the MCS community. The podcast is generously supported by the Marilyn Brockman Hoffman Foundation and listeners like you. If you wish to support the podcast, please visit listen.chemicalsensitivitypodcast.org. Your support will help us continue making the podcast available and creating greater awareness about MCS. To learn more about the Chemical Sensitivity Podcast, follow the podcast on YouTube, Facebook, Instagram, Blue Sky, and TikTok, and LinkedIn. And as always, you can reach me at aaron@chemicalsensitivitypodcast.org. Thanks for listening. The Chemical Sensitivity Podcast and its associated website are the work of Aaron Goodman, made possible with funds from the Marilyn Brockman Hoffman Foundation. supporting efforts to educate and inform physicians, scientists, and the public about multiple chemical sensitivity. The content, opinions, findings, statements, and recommendations expressed in this chemical sensitivity podcast and associated website do not necessarily reflect the views and opinions of its sponsors.